If allopathic medicine is putting other people's donor stool up the colons of patients as a retention enema, I think my herbal or coffee enema may be just as safe, if not safer. As I discussed in a previous video, enemas have been used for centuries all over the world in various cultures and traditional medicines. There's hardly a region of the world where people did not adapt the use of an enema. We know that they are safe beyond the rare misuse of them, but do we have any research in this area specifically? As I mentioned as well, there is not a lot of research on coffee enemas particularly, but there is a lot of research on various enema therapies for various conditions. So let's look at some things that I found in the literature. One group was given lactobacillus enemas or placebo enema for 8 weeks to children with active ulcerative colitis. At 8 weeks, there was significant clinical and histological improvements in the probiotic group enema versus no significant change in the placebo group. Another study covered herbal retention enemas on chronic ulcerative colitis. The effect of the treatment group was markedly superior to that of the control group. The study showed that the QAKJP, this is a Chinese herbal preparation as retention enema, could rapidly alleviate the congestion and edema of intestinal mucosa, promote the healing of ulcers, inhibit spasms, and helped diarrhea. Next, a meta-analysis looked at 28 randomized controlled trials with nearly 2,500 patients. The results showed that retention enema with traditional Chinese medicine herbs had significantly better effectiveness than those of the control group. Here's another randomized controlled trial looking at 3 different groups. Group A was treated with Chinese herbs given both orally and in a retention enema. Group B, just Chinese herbs given by retention enema alone. And Group C was just given Western medication only. Group A, the group that had both herbs orally and in enemas, showed the best outcomes in all of the aspects of clinical effectiveness. So in other words, take your herbs from both sides. Next paper, a turmeric extract was given as a retention enema for 8 weeks. It produced a trend towards more remission compared to placebo enema in patients with ulcerative colitis. Patients who completed all 8 weeks of therapy experienced significantly more remission, 71%, than those in the placebo group. Now, enemas don't just help GI conditions, but they can help other condition states as well. Hepatic encephalopathy, HE, is when the liver is not working as well as it could be and toxins build up in the blood. These toxicants can affect the brain and affect neurological function. Now, standard medical treatment is symptomatic treatment for this, such as neutralizing blood ammonia, which has poor outcomes and high mortality. Retention enema with traditional Chinese medicine has been used for treatment of HE in China for many years. The authors of this study wrote that it has been clinically shown that retention enema with TCM is effective and safe. This is a strong basis for the treatment of hepatic encephalopathy with herbal enema. Another randomized controlled trial looked at the treatment of chronic severe hepatitis by retention enema with Chinese herbal decoction. Good therapeutic effects were shown in the treatment group with a total effective rate better than that in the control group. It lowered ALT, AST. These are general enzyme markers for the liver. It lowered total bilirubin and improved other serum markers as well. And it also helped ascites, which is fluid buildup in the abdomen, and it prevented HE, hepatic encephalopathy. How about kidney disease? 78 patients with hyperuricemia, elevated uric acid in the blood, were assigned to 2 groups. One group treated with retention enema of Chinese herbal medicine combined with oral intake of a pharmaceutical, and the control group was treated with just the pharmaceutical alone. They found that the retention enema with the Chinese medicine used along with the pharmaceutical had better renal function and lipid metabolism versus just the pharmaceutical alone. Researchers in 2021 working on a systematic review looked at colonic dialysis combined with retention enema in the treatment of chronic renal failure. They wrote that the treatment method used in the study is colonic dialysis combined with traditional Chinese medicine, retention enema, so that the metabolic harmful substances produced by the body can be discharged from the intestines and then the damage to the organs of the whole body can be alleviated. It was their conclusion that colonic dialysis combined with the enema in the treatment of chronic renal failure can delay the progression of renal disease. Now, something I want to note here, with renal failure specifically, Western medicine does not even entertain that end-stage renal disease can be healed or improved, which is flat out wrong. I have direct experience with this in my own patients and clients and my own family members, and my colleagues have similar experience. Renal failure can be temporary if the right steps are taken to allow the kidney tissue to heal. Enemas can play a role for that, just as this study mentions. I'm shocked at how dismissive many medical doctors are of therapies that can actually help the patients that they take care of. They would rather just let their patients worsen over time than to even explore other options and admit that maybe there are better options available that they've never learned before. Next, let's look at endometriosis. A clinical trial looked at endometriosis and the efficacy of Chinese herbal enema combined with intrauterine douching for these patients. Chinese retention enema combined with the douching was performed on patients in the test group. The embryo implantation rate and the clinical pregnancy rate were compared between both groups. The pregnancy rate and the embryo implantation rate significantly better in the herbal group versus the control group. Moving on, researchers at an academic hospital retrospectively reviewed patients who underwent fecal microbiota transplant by retention enemas. Okay, fecal transplant by retention enemas. This is a treatment for those with so-called C. diff infections. Now, I don't know what I think about holding another person's stool slurry as a retention enema, but this is a conventional procedure that they do for some patients that they diagnose with C. diff infections. But the reason I'm listing it here is because if allopathic medicine is putting other people's donor stool up the colons of patients as a retention enema, I think my herbal or coffee enema may be just as safe, if not safer. I'm just saying. And lastly, Dr. Karazian is a Harvard Medical School trained and award-winning clinical research scientist. He's an academic professor, world-renowned functional medicine provider. I've actually studied under him and at his institute many times, and he has a great resource for enemas. He also actively recommends coffee enemas to many of his patients, even though he also knows there are not a ton of studies on coffee enemas, but he understands that there are lots of research on retention enemas, and he has seen that they have drastic benefits clinically. So you can check out his article as well. So in conclusion, this therapy has been done all over the world for centuries. It is done for many ailments in Chinese medicine, Ayurvedic medicine, and other indigenous cultures. I have personally used this type of therapy. I have used it with patients and clients over the years. And there is actually really good indication that retention enemas can help several types of condition states. Of course, do use care when performing at-home therapies of any kind. Make sure you are prepared, educated on how to do them effectively and safely. Take your herbs from both sides.